that everybody can hear me loud and clear. If there are any issues, just message on the chat or let Holly know and we can troubleshoot. But I'm very excited to, first of all, introduce myself. My name is Dr. Kaywaan, and I will be going through the talk about polynucleotides today. And in particular, we're going to be focusing on nucleophil. I'm going to try to make this as interesting and exciting as possible because I know we're going to have a range in our audience, which will include practitioners who may already be using polynucleotides in some shape or form, or have never come across it before. And we may even have people who are just interested in having it as a treatment. So I'll keep it broad, I'll keep it interesting, and I'll also have a bit of science and practical in it as well. Now, to get started, polynucleotides are a really exciting area of regenerative medicine. It's this whole idea that there's one thing that we all can agree on. We hate the aging process. And that's what we're trying to almost battle and reverse through being in our aesthetic clinics, not only just from the physical aspect of what we see, but also the way that we feel inside. And polynucleotides has actually grown within medicine beyond just aesthetics. But of course, we're going to be focusing on the skin today, and I'm excited to introduce it for that indication. We're going to move on to the next slide. So we're going to run through this within the next half an hour. It's going to be a nice, short, quick one, but we're going to cover a lot on it as well. Okay, moving on. So a little bit about myself. I have been in aesthetics ever since even while I was in medical school. And I went to Imperial, so just around the corner if you're in London. And I've got 2 branches within London as well. As well as having my own 2 branches, I teach at the Medical Training Academy, and I've been doing so for a few years. And I love being a part of research and also teaching. So this is exactly where I want to be right now, going through everything about polynucleotides for you all. Okay, so PDRN, polynucleotides, these are really confusing terms, especially if you're either a client or you're new to using them. What is this? And sometimes people will say that this comes from salmon, and they say all these weird and wonderful things, and it actually can put some of us off. But essentially and very basically, it's part of what we all have inside us, where any living organism will have nucleic acids, and nucleic acids are the basis of life. But they're also very hard to produce for the body, or they're very hard to produce in general. I mean, if we go back to evolution, there's one part of the puzzle we still haven't solved in evolution. How did the first nucleic acids come about? Just to create them de novo, the kind of chain reactions, incredibly difficult, and they just don't appear in nature on their own. And nucleic acids are somewhat a struggle for our own bodies to make as well. There are a few different pathways, but this is where PDRN comes into, or polynucleotides. Being able to replace those nucleic acids, they can act not only as signaling molecules, but it can also replenish the skin. So PDRN is essentially nucleic acids. They're already present within our body and all living organisms, and we're basically harnessing the power of those in reversing the aging process, or healing and wound healing. To the next. So as I mentioned, they work in a variety of different ways. One is through cell signaling. One may be part of it would be receptors and binding and locking into those and causing a chain reaction happening. And another part of it is just replenishing the nucleic acids that we're going to be using as building blocks when we go on to cell division. Moving on to the next. So you will come across this as different molecular weights, and you're going to wonder, okay, so I understand the whole concept of nucleic acids, but why do we have so many different, within different brands themselves, there are the medium, the strong, there's different viscosities, but quite similar to how you would use fillers and hyaluronic acid, and you will come across different versions of those. This similarly just has a different concentration, and as a result has different indications. I don't want you to get too bogged down on this right now. We're going to move on from this slide, and we'll come back to how we're going to use the different strengths for different indications. So The talk today is focusing on a particular brand, Nucleofill. Nucleofill is probably one of the most famous brands that offer polynucleotides. They've had really good marketing, but not just that. It's the word of mouth that has perpetuated after this has come onto the market, and all the clients and all the feedback that people have said about Nucleofill just being a really, really good product. I've used it myself, and I've used a variety of different other brands, and I could say that this has worked really well for me, and I'm excited to be talking a bit more about it. But essentially, in terms of just the profile of the product, it's goes through a very high purification process, as would any of our products that we're going to be administering in the UK. And it's got a pH which allows it to be a little bit more gentle when it goes into the skin. As you can imagine, products that don't have lidocaine can sting a bit, but being at the right pH level just makes it a little bit more tolerable. Moving on to the next. So the best thing about polynucleotides is you don't have to be so scared about using them. And what I mean by this is that when you come across hyaluronic acid, and hyaluronic acid is amazing. I'm not trying to replace your use of hyaluronic acid with Nucleofill. I'm going to talk a little bit more about how different products can complement each other. But Nucleofill can be used in different areas of the face, the body, but also at different depths. And if you were able to use the strong or the medium in different layers, there is no real harm in doing that. Remember, this isn't an implant filler, which is meant to just stay for a significant period of time. This is primarily used to rejuvenate. It's another form of a booster. And so it's safe to use in different layers. And I'm going to teach you how we can use them in different layers as well. Moving on to the next. Okay. So as we mentioned, it can go into different layers, and at the different depths that we're going to be using them, we can achieve different effects. On to the next. This is your bread and butter. You guys have seen skin layers all the time, and there are lots of cells in our skin that we need to be aware of. Melanocytes, keratinocytes. These are probably the key things that I guess we're going to come across again and again, and fibroblasts as well, in our connective tissue areas that we're going to talk about throughout our presentation, but also in other presentations that you would have come across. The regulation of our melanocytes to, keep our skin tone even, preventing things like melasma and post-inflammatory hyperpigmentation, stimulating our fibroblasts to build up that collagen and keeping our keratinocytes healthy and not getting too much dry skin on the surface or too much layered or scaly skin. The whole regulation of all of these cells is important, whichever product we're using when we're implanting it or injecting it. And PDRN, in this case, actually helps to regulate a lot of these cells. So the risk of things like post-inflammatory pigmentation or edema and everything else that we are concerned about when injecting is minimized because this product favors and regulates cells. So what does it actually do? And I think this is something that any practitioner needs to really get their head around, because when you're explaining it to clients, just saying the words polynucleotides and saying all the jargon is not going to be a seller, and it's actually really important for you to understand how it works. So I've mentioned a little bit about nucleic acids and what they are, but I want to talk to you and I want to take you through a video which shows a little bit about how it works. So Holly, if you could bring up the YouTube video.
2 secs.
Right, so while that's just happening, I'm gonna. It's just ready now.
PDRN, which serves as a booster to promote regeneration in our body, reliably restores human tissue in 2 different ways.
So as
The
you can
first
see,
method,
there is the A2 receptor stimulation, and there's also the salvage pathway. This is really important to note that there are multiple mechanisms and we're still trying to work out fully how PDRN works. And that's a lot with medicine. I mean, we still don't know fully how paracetamol takes away our pain. And it's important to note that while we're trying to understand these mechanisms and explain why it has such a positive effect, there is obviously a positive effect that we've seen in our clinical trials, but this is just the science behind it to give you a bit of an understanding. So let's go down the A2 pathway and see what happens with that. Continue to play.
The first method selectively stimulates the A2 receptor, which actively engages in the wound healing process of the cells. When the A2 receptor is stimulated by PDRN, the wound healing process, which regenerates the cells, is facilitated in 3 ways. First, quickly terminating the inflammatory response through the inhibition of the secretion of cytokine, such as HMGB1, TNF-alpha, and interleukin-6, which triggers inflammation, and inducing the anti-inflammatory cytokine interleukin-10 to reduce the transition time to the cell proliferation phase. Second, stimulating fibroblast, chondrocyte, and osteoblast by promoting the secretion of various cell growth factors, such as FGF, EGF, and IGF, which not only promote cell proliferation, but also
So T cells to be, so initially we talked about cytokines being released. This is the chain of reactions and all the chemicals that release from binding to that receptor. These chemicals will help to regulate a lot of our cells. And we talked a little bit about keratinocytes, melanocytes, but most importantly, these fibroblasts, osteoblasts, and chondrocytes. These are the cells that are the fibroblasts producing the collagen, the chondrocytes helping with a lot of our cartilage and connective tissue, and the osteoblasts helping with our bone. And as you know, with the aging process, what is actually happening is that we're losing all of those as we get older. We're losing the ability to produce them at the rate that we do when we're young. And we get a lot of oxidant damage over time as well. So this is having that antioxidant effect. This is having that stimulation effect. Okay, so we'll carry on playing.
Use collagen and non-collagen substances for the generation of normal tissues. Third, rapid generation of capillaries resulting from the stimulation of the VEGF, which is involved in angiogenesis. The capillaries supply nutrients and oxygen to and remove the waste from the wound. The second method utilizes the salvage pathway. The de novo pathway for general tissue regeneration is synthesizing the DNA nucleotide needed for tissue regeneration from amino acids. When PDRN is administered, the DNA biosynthesis step can be skipped by directly supplying the DNA nucleotide needed for tissue regeneration, meaning that no energy is.
So as you can see that there's 2 pathways. You can take amino acids and you can put them through lots of different chemical reactions, which then lead you to having your nucleic acids. And then finally we get the ability to produce DNA and so on and so forth. But the salvage pathway, which is actually using the oligonucleotides, the polynucleotides that you're administering to the clients, just allows that process to be skipped and actually further supplements the skin and the tissues here with the nucleic acids. We're going to stop the video now. We're going to continue the presentation. So I think it's really important for us to appreciate the science behind it. The thing with anesthetics that I find is that a lot of us will come across these products, new products, and we'll just start using them just because everybody's talking about how great they are and how well they work. But it's really important that we have an idea of why they work and how they work. There are so many people that I'll ask them, what is hyaluronic acid? And not one person in a room would be able to tell me it's a glycosaminoglycan and it's polysaccharide and it helps with hydration and where it's present in the skin. But they will be able to say that, it's great for anti-aging purposes and it feels really good in my skin when I put it in my skincare bottles. So it's nice to know what happens practically and clinically, but it's also really important that we know the science behind it if we're practitioners administering these treatments. So coming back to what it actually does. Now we've talked about science, but how does that translate into the practical or the clinical effects of it? So the clinical effects are that we're going to get this regeneration. We're going to get the wound healing. We're going to get stimulation of collagen and fibroblasts, which allows the skin quality to improve, feel softer, feel smoother, seem a bit more hydrated, but also be more resilient in general, which is what all of these effects are trying to depict here. Okay, we'll move on to the next slide.
Sorry, I missed what you said there. Went on mute.
We'll move on. Let me just change that. Can you hear me?
Yeah, I can now. Didn't hear what you said.
We're going to move on to the next. Okay, so we talked about stimulation of fibroblasts and allowing the, essentially when you have cellular replication, you are having more DNA and nucleic acids being produced, and this is where PDRN helps with that. Moving on next. And there's this kind of one final added benefit, this gym effect, which is the myofibrils that we have, or the fibers that we have within our cells. They actually contract a little bit, and that's where you see that immediate tightening effect when you use polynucleotides. And I'll have a video to demonstrate that later. Next. The video here demonstrating how that tightening effect's here, but I'll show you clinically and how that translates. Move on to the next slide. And move on to the next. So we've talked a bit about this, the skin, the vascular level with angiogenesis, supplying the blood, and how the indications move on just beyond skin. We're going to come across like to hair, and obviously you may be aware that polynucleotides are also used in cartilage in people who are suffering with arthritis, and we've talked about wound healing to a certain extent. There are some polynucleotides that I think there may be one that's approved on FDA that's used in patients with liver problems. So there are actually medications now being administered with this technology. Moving on to the next. And again, so we've gone through this already through that video. And this just talks about how that vascular angiogenesis, how it's going to be able to help within hair growth as well. Moving on next. And you know, we talked about fibroblasts, osteoblasts, chondrocytes, so all the different layers of the tissues are impacted by having PDRN, so it can be administered at different levels. And we talked about the A2 receptor and how there is this G protein kind of receptor cascade of events that happen. Of course, we don't want to bog down too much into the science, but it's important to be aware that these reactions are happening which lead to the effects that we're seeing. And this one talks a little bit about protecting our fat pads, which I don't think there's a lot of products out there that do that. We've got lots of things out there that help to break down the fat. And polynucleotides here aren't there to break down fat. So do not sell it as something that's going to make someone necessarily slimmer, or using the equivalent of, for example, Aqualex or lemon bottle, whatever we have. Polynucleotides actually act very differently in that they protect our fat pads from changing the shape, the size, and moving around. So that's really good when we're talking about using it in the cheek, the mid-face, and areas where we really see a huge difference over time. So it's exciting that we now have a product that protects that, and we don't have to just fill with hyaluronic acid. Moving on. Moving on to the next. Okay, we talked about osteoblasts and protecting the bone, and the bone being obviously a very important aspect of the aging process. Moving on next. Okay, and then we're going to go through a little bit about the nucleophil range. Moving on. Okay, so now we're going to go through nucleophil, medium, strong, and the soft, and the range that we have. But before I move on any further, I'm just going to take a moment to talk about boosters in general. So I run a course on boosters, and I also do a lot of it in my practice. And I whole boosters. Many of you here may have come across a huge number of them already, and we're almost getting overwhelmed as practitioners with all that's out there. We are familiar with Profiler, one of the biggest kind of skin boosters that came out on the market, and then there is hyaluronic acid, that's low cost thing like Volite, and skin boosters like Restylane. And then we have these PDRNs, we've got exosomes, we've got combination of hyaluronic acid and other cocktails, Redensity 1, Biotics. We've got all these products, and we're just kind of, as practitioners, trying to think about, oh God, where do we use them? When do we use them? Which one do we choose? And it can become overwhelming. So I want to just clarify that there are certain indications where you'd use some things over other things. Now, we have hyaluronic acid as one of the most amazing anti-aging molecules that we've discovered. And it's so exciting that even today, we're still coming out with more versions of hyaluronic acid, the way that it's cross-linked and the way that it's produced, and it will never go away. And anyone who says bad things about hyaluronic acid and is trying to sell a different treatment to say that hyaluronic acid is bad is using it wrong. Hyaluronic acid is amazing, it has its purposes and has its indications, but it can't be used for everything all the time. And there's only so much you should be putting into someone before it's like too much. You know, you've always heard of good things in moderation. And I think that's what we need to be practicing now with hyaluronic acid. I think we maybe a little bit overdone it now in some cases. And this is where we have other molecules that we need to be targeting. And what is it that we're trying to do with our patients? We're trying to give them the youthful, healthy appearance of their skin, of themselves, making them feel better. And yes, hyaluronic acid gives you that immediate effect, particularly filler when it's cross-linked. But what we're trying to do is be anti-aging and antioxidant. And this is where PDRN comes in. This is where polynucleotides is giving you that additional, look, I'm going to look after you holistically, and I'm not just going to push for one thing just because it gives you that immediate result. So it brings me to, what do we expect with these treatments? We've talked a lot about the science, but does it actually work? So at this point, I'm going to talk you through a little about Nucleofill, and then I'm going to show you a video. Nucleofill medium. So Nucleofill medium is a offering of polynucleotides that comes in a 2% gel. It gives you all this data about molecular weight, how much is in the vial, which is 1.5 mils in this syringe, the pH, and the viscosity. That doesn't really mean very much. I mean, as a practitioner, it depends. Some people love this kind of data. What does this mean to us practically? Nucleofill medium is basically something that you can use anywhere and everywhere. Some people may say don't use it around the eye area. You can. You can basically use this anywhere and everywhere. This is your universal product. And for all age ranges as well. It will give everyone a benefit to a certain extent. There is a Nucleofill soft product that is indicated more for the periocular area, which I'll show you a video for as well. But the only difference is that it has less of a concentration so that there's less downtime. So if you were to inject in a papular technique, you will get less downtime, so it will go away within hours rather than days. Whereas if you were to inject Nucleofill medium or strong, it may take a bit longer for those papules to come down. But used in the right way, these different products can have low downtime if you just understand how they work. So for Nucleofill medium and strong, let's just run through these 3 slides, and I'll show you the video. So lifting, tightening, moisturizing, wound healing, so we talked about scars, and just a bio-restructuring treatment. And let's go to the next. And we've got strong, which is even more concentrated, and this is even better for those when you're going down to the bone, particularly when we talked about, you know, the osteoblast regeneration, but at the same time giving that lift. Use strong down to the bone, in the cheeks, in the chin, in the jowl area, in the gonial angle, and you can see immediately that restructuring effect. Some people who are really wild and rogue will try and use this as a papular technique on the skin, and you can, and it will give you an amazing result. But as we talked about, the papules will stay on longer, and the papules staying on longer is not a bad thing clinically. The longer the papules stay, the more of that change it's causing in that skin on the very surface, if you're doing surface skin rejuvenation. But the problem with that is those papules take long to come down, and the patients are going to hate you if it's going to take them, you know, 3 days of not being able to go outside because of those papules. But every client is different, and some people are so up for downtime. Okay, moving on to the next. So a little bit about Nucleofill strong, just gives you that extra concentration and therefore giving you an even more stronger treatment. Okay, so I'm going to show you a technique that I've used on a client, and so we're going to go onto a video. And Holly, this is the video that I sent you as a video, not the one on the social media.
Okay. 2 seconds.
Polynucleotides are the latest wave in regenerative medicine, and Nucleofill here is one of the most famous products utilizing this technology. And I'm going to show you how it's done. Finish out. What are your concerns?
So my main concern is my skin's sagging and going down, and it shows really a lot around my jawline and my neck.
So we're going to be using polynucleotides here to tighten the skin around the jaw and also the neck. It works by delivering nucleic acids and nucleotides, which will help to regenerate the skin and keep it nice and taut. So Najat, you've just completed this treatment. I want you to have a look and tell me how it's feeling as well.
I mean, it's a weird feeling. I don't know how to explain it. It feels kind of tight, and it's like pulling. It's just amazing, Kaywaan. Thank you.
I'm glad to hear that. I'm going to get the camera to come a bit closer. If you just put your chin up a little bit, I want to zoom in on those bumps that you've got onto your skin on the neck area. Now, they're hard to see, and they are going to fade away in around about 24 hours. But what this should do is hopefully boost those collagen fibers and help those fibroblast cells to tighten the skin a little bit more in this area. But already you can see that the chin and the jaw, it seems a bit more tighter.
It does.
This isn't a filler. Remember, this is polynucleotides, and it's just there to boost everything you've got there underneath already.
My profile is already better. It's in my head, but it is, isn't it?
It definitely is. It definitely is. Great. Thanks so much for playing that. We're going to move back to the presentation. So I feel like it's so cheesy and such a marketing thing, but at the same time, it does depict what I'm trying to demonstrate here. You can use this in different ways, and in this example, I've injected it down to the bone. So I know on this slide it gives you a method and an approach, but this is where it may be beneficial for some of you to come on a practical session with me at Promo Italia, where we can actually run through some of the techniques, and there are so many different ways that it can be administered. But the way that I did it here for this client who was complaining of the skin in her lower face starting to be looser, she's 46, so she was really finding that this area is problematic, and she wants to avoid using fillers. Remember, fillers aren't a bad thing, and I don't want to speak badly about them, but there are just some people out there that don't want implants. And the amazing thing about polynucleotides is that it does give you somewhat of immediate effect. You really do see that difference, and it keeps on giving. And I've used 2 techniques here. I went down to the bone and did a pyramidal technique on the chin and the gonial angle, and also the jowl sulcus area. And after that, I went down a bit lower into the neck area, just in the upper neck or the lower jaw area, in a papilla technique, in a grid-like fashion, in order to deliver the molecules to get that myofibril kind of tensing effect. You know, that tightening effect that I talked about earlier? It causes that in the skin there, while the polynucleotides down to the bone is helping with those osteoblast activation, the chondrocytes, and just restructuring there. So those are the benefits of using it. And this client was saying if the result was somewhat immediate for her, of course, you may see a difference immediately, but it's really the stuff that's going to happen over the next 2 to 3 months. Now, given this isn't a filler and an implant, don't sell a dream to this client. You need to be very realistic about what it is that we're trying to achieve. We're trying to achieve stimulation here, and that doesn't happen overnight. It does require more sessions. And I would always try to encourage clients to have 3 sessions. Or at the very least 2 sessions, in a similar fashion to how Profilo recommends 2 sessions. It's because it's not a filler. It is a booster, and boosters do require more than one to see the best outcome of it. But if people do just want to do one, you will still see a difference. Now, what is the strategy that we use most commonly with boosters? Many of you are familiar with the BAT technique that was used in Profilo, and some of these markings here on the screen, as you can see, are similar to those of the BAT technique. So you can administer it in a similar fashion. You can go deep dermis, you can go down to the bone in these areas, or you can go papilla and very superficial onto the skin. Why? Because this is polynucleotides. As I mentioned before, you can use it in all those layers. But one of my favorite ways of administering is a pyramidal technique where we actually go through every single layer. We start at the bone and we lift the syringe off and slowly continue to, I guess, a retrograde linear thread, but actually vertically so rather than horizontally so. Okay, moving on to the next. And we have to be, I guess, appreciative of the ligaments as well as the bone. So this is the reason why we've chosen these particular areas, because when you nourish the ligaments, you can, those are the things that connect the bone to the skin and keep things taut. Cannula is another way that you can use this product. Now, remember there's only 1.5 mils in each syringe, so you have to be mindful when we're actually administering this product. Or you might use a lot of it just going down to the bone and using that papilla technique. When you do use a cannula, the benefit of using a cannula, as many of you are already aware, is that we can do a little bit of subcision and mechanical stimulation of collagen just by going in with a cannula. And then leaving behind the polynucleotides to then heal those wounds that we've created with the cannula is also really beneficial. There are, again, lots and lots of different ways that we can use this cannula in order to administer. And they're quite similar to if anyone's ever gone to a course where a booster is used with a cannula, or maybe, for example, Juvederm harmonica is used with a cannula. They will show you it goes into almost like the hairline, and some of it goes into the lateral part of where the tragus and the ear is. Those are similar methods of way that we can administer the polynucleotides, because it's all about tightening and lifting in these regions. And then, as well as the lifting and tightening, the other way that you can use cannula is for subcision if someone's got acne scarring. And this is, again, another good way of delivering really effective skin resurfacing and skin boosting results for people who've got scarring. So the multi-injection technique, which you just saw in the previous slide, is the papilla technique that I was talking about. You go superficially, you leave literally droplets. It says 0.1 mil, it may be even less than that in some of these areas. And it's just about leaving those droplets for it to then diffuse and move into different layers of the skin. But the papule itself will cause that expansion of tissue, that volume expansion of tissue on the surface is resurfacing itself. So another amazing thing about this, because this is an implant itself, it can be combined with other treatments quite quickly. You don't have to necessarily wait a long period of time. Obviously, our concern with HA fillers is that if we use heat energy devices quite quickly after HA fillers, you break down some of the cross-linked bonds, and we actually change the structure of hyaluronic acid when we do that. So we're very cautious when we administer HA and then follow up with an energy-based device. But the benefit of using nucleic acids and other boosters is that you can actually do a lot of things together that can maximize the potential of the treatment. So a lot of people like using microneedling or microneedling radiofrequency lasers, and some people even do peels on top, and it's all possible to do. Again, if you want to see some of this done, a practical session will be very useful. And actually just note some of the things that you want to see so we can make it a very personalized practical session. Okay, moving on. So some protocols of how you can administer these treatments. You can do one every 2 to 3 weeks. That's a really nice way, but it also depends on downtime. This I'm not super strict about. I base it on what the client is able to handle, what the client is able to, what their goals are and how quickly they want those goals. But the quicker that you do the treatments, the more that you're going to see the results in I guess a short amount of time, and the more impact you're going to have. If I do one treatment every 6 months, you're not really going to see the maximal impact of that initial, I guess, course of treatments. So try and squeeze it in over a period of, I guess, 6 to 8 weeks where you do 3 sessions. And I recommend 3 sessions for everyone to try in order to really judge whether this product is worth it. And again, different protocols where you're using the medium, the strong, the medium, and then the strong. And it varies, again, person to person, but as clinicians, as experienced clinicians, I want you to learn and see the results of doing these on perhaps some of the models, maybe invite some down, and then create some protocols of your own. Moving on to the next. All right, so this is then combined with a radio frequency. And so again, I don't want to overwhelm you all with different protocols, but not only can you do them quite close together, but you can even combine them on the same session. So if you want to see me be rogue in one of those practical sessions, I'll show you how you can combine them together. Okay. And then with lasers as well, so doing it in different days, but you get the gist. This, the manufacturer is advising waiting 2 weeks after each treatment before then administering the lasers. And you can do that as well. That's probably a nice, safer way of doing it. And yes, you can certainly get the protocols. I think there was another question as well. Okay, so how long between these? So the only thing with needling and injectables is that creating trauma to the skin. The more trauma you create to the skin, the higher the risk of infection is. And so you want to minimize how much trauma you're creating. But because this is an implant and this is just going to diffuse into the skin, and as long as you've got a sterile technique with your needling, you can theoretically combine them on the same day. And if the client is sensible, but if you don't trust the client, this is the first time you're treating them, not that you don't trust them, but it's your first time and you don't know how they're going to be with the aftercare, then do space it out by 2 weeks. 2 weeks is the general standard that we apply to a lot of things. But if you're feeling very confident and this is someone that you trust and you know is going to follow the aftercare, you can needle and nucleofill on the same day. You can RF a needle on the same day. You can laser a needle and inject on the same day. And it's just about understanding the principles behind those before doing that. And we can discuss that in a bit more detail. We're coming to Nucleofill Soft, and I just want to show you this because this is something that a lot of people are excited about for the periocular area because it causes less swelling and comes down quite quickly. If you're going to use a cannula, I'd say maybe consider doing Nucleofill medium because it gives you more of a boosting effect in the under eye. And if you're using it almost like an alternative to under eye filler. But if you're using it as a papular technique, Nucleofill Soft is better because it goes down quicker. The papules go down quicker. I'm going to show you a video now of me administering Nucleofill Soft, and this will be the last thing, and then we can wrap up with questions. So Holly, if you come up with a video on the social platform. And guys, while that's happening, if you have any more questions you want to just put in the chat, I'll go through them.
Sorry, one sec.
Another thing that Acre Pharmacy and Promotalia are doing are they're creating, I think, a package or offers for you guys to try this. Make sure you push for, okay, here it is. Help to regenerate the skin. We're going to use this in the under eye area, and we're using specifically Nucleofill Soft. This is going to help address hollowness and volume loss that we get in this area, but also brighten the under eyes and make sure we reduce those fine lines. The beauty of PDRN is that you can actually go superficial with this and address the skin quality right at the surface level. Amazing, really good questions. So that was just demonstrating how Nucleofill can actually be used quite superficially, where you may not use that with a filler because of the risk of tindling. This doesn't necessarily cause tindling. So what are the contraindications for using this treatment? Well, the main thing will be that the risk of allergy is the key thing. Now, people say, if people are allergic to seafood, are you allowed to have this? It's just a caution, and apparently it has a very low allergy rate, so that's something that you're not necessarily need to be too concerned about, but you can always do a skin prick test if you like. There's the risk of infection with this treatment, so ideally we want to do it with people who have relatively good skin quality. If people suffer with very severe eczema or psoriasis or have damaged skin, you may want to avoid it, but those are relative contraindications. The only real absolute contraindication that I can think of other than the allergy that I mentioned is also pregnancy and breastfeeding, because we're not insured when we're doing that. Those are really the main things. Other than that, this is supposed to be quite a universal product. We'll be using it in a lot of different areas. PDRN does come from salmon DNA, so just remember if clients are vegan, they may not want to use this product. And we're finding that a lot of products out there are now coming from, for example, like exosomes are coming from cells, living organisms, and it's just hard to completely replace them synthetically. How long after can you cause a BO with nucleophil? So the science behind BO is very interesting. So a vascular occlusion can happen, or an occlusion in the vessel can happen for a number of different things. This is just a science. It can be an air embolus, an embolus caused by platelet aggregation. It could be an embolus caused by something that you've injected. So any kind of injectable, in theory, has a potential to cause BO. The risk goes lower if it's not a pro-inflammatory injection. So this isn't pro-inflammatory, and a lot of our fillers aren't pro-inflammatory. The risk goes higher if it's a high viscosity gel, and so if you're injecting saline or water, you're very unlikely to cause a BO. You shouldn't, unless you mixed in something with that's pro-inflammatory. But this, what we're administering, is a gel. So just bear in mind, the thicker the gel, there is a slight risk of BO, but it's not as high as a cross-linked hyaluronic acid filler, because the PDRN is supposed to be just absorbed by the body rather than staying put. But as we get to nucleophil strong, and this is why I say administer it down to the bone, the risk is even lower. And it's not something necessarily that you need to dissolve per se with hyalase, because remember, there's no hyaluronic acid here. But that's not a concern that I've had during my treatments with nucleophil, and it's not a concern that we've had in terms of our protocols as well, and our scientific research that we've done. How long after PLLA can you use nucleophil? Okay, so what we'd say about PLLA, this is a good one, because this is something that is pro-inflammatory, and you want that inflammatory response. And it's important you don't mix too many things with PLLA or PCL, or so. Just for context, guys, PLLA is Sculptra, Lanuma, Gary, Alonce. All of these are collagen stimulators, and they are one of the riskiest things that we have on the market, but they can create amazing results. And because they are pro-inflammatory, you just got to be careful with other things that you mix in. I would say wait at least 2 weeks before doing any other treatments, and just keep PLLA and PCL on their own, because you can run into granulomas, not even just on their own, without mixing things. And when you mix things into the picture, it may make things worse. Question: can patients with autoimmune diseases have nucleophil? So autoimmune diseases are a relative contraindication, and as a clinician, I often sit down with a patient and a client, and I talk to them about what their expectations are, what their concerns are. Because if they're on immunologics, if they're on steroids, or whatever they may be on, your risk of infection goes up. That's the main thing with autoimmune conditions. And sometimes autoimmune conditions behave in funny ways in which we don't understand. And so they react to certain medication and drugs that other people won't react to in the same way. So you have to consult really carefully your patients about that. We don't know how high the risk of infection will be, and we don't know how high the risk of granulomas and other immune conditions may come about once we've injected. If you're willing to take that risk, then yes. So Nucleofill as a manufacturer won't say do it on immune, and I won't tell you to do that either. Have I done it on people that got immunocompromised? Yes, I have. I've done lots of treatments on people who've got immune conditions. But some of the key things that I discussed with them in the first instance is, what is your control like, and what is are you in remission with it, and have you had a flare? These are the questions that I have with them. And if it's someone who's very not really well managed in terms of their condition, I would say prioritize your condition rather than the skin surface and the aesthetics. Do we need to aspirate? No, I mean, I don't aspirate for anything anyway, so I wouldn't aspirate. I just think that it hasn't benefited me in the past, and I think that's a personal preference, but you don't necessarily need to aspirate with this. Is vitiligo a contraindication on the immune response note? So again, vitiligo, I personally would treat a vitiligo patient, but with vitiligo, you have to consult them, because we don't know what will happen. this is the thing with vitiligo. The last thing you want is a patient saying, oh my God, my vitiligo has gotten worse, even though this may even help the vitiligo. And a part of it is because we don't fully understand the course of that condition. Would I treat someone with vitiligo? Potentially, I would consult them and have a long consultation about what the benefits may be and how this may be off license and experimental for them. So yeah, I potentially would, but it would be considered a relative contraindication to you. Okay, and so I think that's the last of the questions that we have. So finally, I'm just going to finish off with saying that thank you so much for attending this webinar. I hope it's been useful, and it is an exciting new product. It's not even new, it's been around for a while, but it's exciting to be learning about it, and there's so many applications for it. So if you can come to one of our practical sessions, please do, where we can demonstrate some more. And I think they've got an offer going on where you can actually get the practical session almost for free by just getting lots and lots of products delivered to you. And try the products out, even for yourself. I don't know if you can speak to Aka and Primitalia, if you guys are buying other things from them, if they could send you a sample to try, or if you could purchase a few and then they can give you a sample. In addition to that, speak to the pharmacies and actually try this out for yourself. The last person mentioned atopic dermatitis. So if someone's got some skin irritation, you do want to be careful with that. You could potentially use it. Remember, Nucleofill is used in wound healing. While I might not use fillers for it, I may, again, off license, say we can give it a try if the patient's willing to. But it will be considered a relative contraindication. All right, I think that completes. We've gone into now, just gone over to 50 minutes now.